Hello, my name is Dr. Brian Shiluli, partnering with Ponea Health, and today we'll be discussing about varicose veins. So varicose vein refers to torsions or dilatation of the veins, mostly superficial veins of the lower limbs, which is more of a chronic condition. So the causes of varicose veins are long-standing. Those people who do work that requires them to have long sessions of standing, mostly soldiers, and then anything that will cause a lot of pressure to the lower limbs. That could be pregnancy, people who are obese, and then patients also, people who have been on long-term use of oral contraceptives, people also who are on who have a family history of varicose vein that are also at risk of getting the same. So the cause of varicose veins is just increased venous pressure in the veins of the extremity, the lower limbs, because of incompetency of the valves that have to make sure the blood goes back to the heart. So basically, when you have varicose veins, you will see your veins will be enlarged on the lower limbs, mostly on the calf region. You can see them even just on observation. Sometimes you can feel some pain, and then some extent you can feel some irritation at the site, and then for those advanced cases you will see an ulceration on the same. But a bit of more patients will present with the eczema on the same site. For you to confirm the diagnosis of varicose veins, there's some tests you can do. The common one we do is called Doppler ultrasound, that you check for the continuity of patency of the veins. And then the other test you can do, but not routinely done, we have venography, just showing you how the veins are. And I think the two are the common ones that we do for confirmation. So it's not genetic, but it has there's a predisposition in if a family member has, but it's not linked to the genes. I mean, it's not genetically linked. But if you have a family member who has the same, you have a risk of developing the same. So the people we mentioned already, we said those who have long-standing history, those who have obesity, those who have gravid women, those are the people who are at risk of getting the varicose vein. So for varicose veins, we have three options for management. We have conservative management, we have medical management, and surgical management. For conservative management, you do things that can prevent or that can alleviate the symptoms for varicose veins. The commonly ones that are done, we do something called compression stockings or graded stockings, where you put on stocking that will improve venous return, also improve the competence of the valve so that you have good venous return of the blood. And then number two, we encourage the patients to elevate their limbs above the level of the heart so that the venous return is also facilitated by gravity to go back to the heart. And then if they don't respond to those are the two options we have for conservative. If they don't respond, we go to medical management, where we have some medications we can use. We call them sclerosing agents. They tend to thin the lumen of the blood vessel, the vein, so that it becomes a bit hardened, then it gets destroyed. It's absorbed later on, so the varicose vein disappears on its own. Then for the surgical management, the commonest one that's done, we do something called ligation and venous striping. So what happens is that you ligate the blood vessel, the major vein, and then you stripe off the tributaries, so we don't have supply to that vein, then it dies off. But we have other ablation therapy, and I think those are the two ones that we do. Thank you so much for joining me in this episode and discussion. You can book my services through ponea.com.